So my name is Farah. I work with the Mystic, where we help companies manage and report their carbon emissions. I'm here with Janet Smith, the Head of Sustainability for the Royal Wolverhampton Trusts. So the Trust is one of many involved in the Greener NHS Programme, in which the NHS has set the target of becoming the world's first net zero national health service. So for the emissions that they control, the target to reach net zero is 2040, and for the emissions that are out of their control, it's 2045. So, Janet, would you mind telling us a little bit about your role at Royal Wolverhampton Trusts?
Yes, my role in Royal Wolverhampton actually is a head of sustainability. And the main part of my role is to ensure that the Trust Green Plan is implemented. So it's actually looking at facilitating the initiatives that each of our service comes up with and ensuring that they get the proper support that they require, whether it is internally from different departments within the trust, or externally from our partner organizations as well, within and outside the NHS.
So, to kick off, what are your thoughts on the Greener NHS Programme and the targets that they've set?
I think it's about time really for the NHS to address the climate change, to address its carbon footprints, because as you know, we contribute over 4% of the whole country's carbon footprint. The resulting climate change and its impact actually really affects the health of the communities that we work with. By going into the whole initiative of reducing our carbon footprint as an organization and also as a trust, we will actually also be addressing health issues as a consequence of the climate change impact, like increases in asthma cases for children, things that also affects our women in terms of their maternity services, etc. So it is about time, and it is about time for us actually as individuals as well to look at what we do to also address our own carbon footprint.
Yeah, I definitely agree. The NHS is a large organisation. As you said, they do make up around 4% of the UK's carbon footprint, so it's also a threat for global public health. So in 2019, the Trust's carbon footprint was just over 19,000 tonnes of CO2 emissions. What kind of figure is the Trust looking at now?
Well, at the moment, it's about 3 times that. A traditional way of looking at it relates to buildings. So your estates, your buildings, your energy, your gas consumption. So those are the traditional sources of carbon emissions that we looked at. And the 19,000 odd tons of carbon that we've established in our green plan actually relates to scope 1 and scope 2. We are actually now looking at increase of that. So our scope 3 carbon emissions actually made up about 72% of our carbon footprint, and the direct ones, so the ones that's like the energy, the gas consumption and things like that, are made up only a proportion of what we now have. So, and the biggest contributor actually of that carbon footprint that we have determined after a carbon footprinting exercise is it's actually our supply chain makes up 33% of the carbon footprint at the moment. So, and that's where the challenge actually lies.
It looks like each trust has their own version of a green plan, which details their commitment to achieving net zero. What would you say have been the most successful sustainable measures that have been implemented at Royal Wolverhampton Trust so far?
What the trust do at the moment is we are addressing the carbon footprint of the service. So let's say for a clinical service, we have the orthotics services, orthotics team. They are one of our pioneer in terms of greening their service. So what they have done is they look at how they deliver their service, the patient pathway, how they also use their buildings, how they also carry out or deliver their administration service. They look at their carbon footprint in a holistic manner. So what they've realized by looking at their patient pathway, that actually they could reduce it quite a lot. So they managed to reduce the carbon footprint on that one by over 18,000 miles, which is equivalent to about 6 times around the world. So and also They have reduced over 78,000 miles a year on their logistics. So they've reduced the frequency of their deliveries, and they have reduced that 78,000 miles. That's how much they've reduced it by just looking at their internal processes. And they have, gone paperless with referrals, with their word booklets and things like that. So by doing that, they have reduced a lot of their carbon. We've managed to reduce our use of volatile anesthetic gases, and particularly desflurane, from 13.9 to 3.1, which is below the target that the NHS National set. You might have noticed that within our green plan, we did set the target of reaching 25% reduction of our carbon footprint by 2025. I could say that we are actually on course of hitting that one. And one area that we have made quite a difference is our energy use, because we have now, our source of energy is now actually through renewables, so which makes it a zero carbon.
And considering how much pressure that the NHS is constantly under, do you believe that it's imperative for the healthcare sector to be prioritising sustainability right now?
There are a lot of things that you can do within reducing your carbon footprints through looking at already existing processes and making them more efficient and effective, and while at the same time reducing the carbon footprint of that. Like what I have cited earlier, the orthotics team, all of those initiatives that they have actually implemented did not cost them anything. So it doesn't require investment from the trust itself, but in fact it then delivered some carbon reduction and also delivered efficiency in terms of monetary. Because when you actually go paperless, that means you don't then buy paper. That means then that's a cost reduction. It might be little when you look at it individually as a different service, but when you extrapolate it to the number of services that we have across the trust, then you will then see quite a big gain in terms of cost improvement. The other thing as well is that one of our team, the patient moving and handling team, by switching our patient slides into a more sustainable one, a slide that actually made up of recycled drinks bottle, so water bottles, which is going to save the trust 1.8 tons of carbon. But then it also delivers cost improvement of £1,500. So it might be small, but like I said, when you bring all of these little things together, then they become then bigger.
I mean, yeah, you've got to start somewhere. So the small things definitely make a big difference.
Yeah, we do have a reuse of furniture as well, and equipment and devices. And last year, we realized almost 26K of savings by reusing them, and also realizing 13.2 tons of carbon reduction. There are little things that you can do that didn't cost us anything, which means then that it's not about the big things that you can do that would need thousands of pounds of investment. It's about looking at existing processes and how you can make it more efficient, and also looking at how you can switch it around.
So NHS suppliers are also being encouraged to align their sustainability targets with the NHS net zero trajectory. Has the Trust implemented the Evergreen supplier assessment in any way? Do you kind of assess whether a supplier is sustainable before working with them?
At the moment, we are actually the PPN 0620 and PPN 0621 has become mandatory for each of the trust, and that's actually one of the things that's where the Evergreen supplier scheme actually comes in. So we are following the supply chain roadmap to reach net zero. And we are working with them with regards to actually working with suppliers as well, and following the Evergreen scheme, because it's the only scheme at the moment that allows suppliers to engage with the NHS with regards to aligning with what the NHS supply chain wants to do as well. So we do work very closely with NHS supply chain, and as a trust, we always, as part of the implementation of PPN 0620, we include social value and sustainability in our procurement exercises. And the NHS does deal with a lot of suppliers, and not all suppliers are at the same level. There, where a bigger supplier might say, yes, okay, we can comply with all of the parameters that set out by NHS supply chain to actually participate in any of the future procurement exercises. But social enterprises, small, medium business, doesn't necessarily have that capacity yet. So that's why we work with our local companies, we work with the national supply chain to ensure that we're not actually making it difficult for suppliers, particularly local suppliers who are small and medium enterprises, and that they're not locked out from the procurement exercise that we're currently doing. So it's there's a support in there, and that's where supply chain also supporting each of the trusts. So it's a kind of symbiotic relationship between the national supply chain body with our local suppliers as well, and with ourselves.
So do you think that the public actually understands or is even aware of the importance of sustainability and the effects that it has on healthcare?
There is awareness, but I don't think there is really an in-depth understanding from the public about the effects of the health service and the procedures that they actually undergo in the hospital to the whole greenhouse gases and the climate change, because not everyone, and I think between you and me, before I became head of sustainability or involved in the sustainability journey, is that I never knew that when I had a procedure that the fluorine that was used was actually has the highest potential for greenhouse gases. So in the sense that I didn't know that, and now actually this time I know that needs to be reduced because it's so harmful. It could actually stay so long in the atmosphere, and it's contributing a lot to the greenhouse effect. And the other thing is like nitrous oxide or the ethanox that when our pregnant women goes into triage or to labor, and then they're given ethanox to help with the pain. But nitrous oxide and ethanox actually also has a high greenhouse gas effect. So no one knows about that. I think it's when we look at the things that we do within the health service, it is also imperative for us to actually educate the public on the carbon footprint that each of those carries. When a person actually visits a hospital, that has a carbon footprint by the number of miles that the patient actually travels. So it's about looking at educating the public about maybe there are alternative ways of delivering that service, and that's where virtual clinics comes in and things like to reduce the carbon, the care miles, and sometimes patients as well when they actually come on site and they find that there's no available car parking space, and then it does add to the anxiety and the stress of going into hospital. So there are a lot of things that we could do to educate the public about the impact of the delivery of a service every day to the carbon footprint of the trust and the carbon footprint of the country as a whole.
Yeah, I mean, I absolutely agree with you. I don't think it's that people don't care. It's just the awareness is missing. And that's where it comes in, just educating the public, letting them know better ways to do things. So I'd also like to just ask you a little bit about the reporting process at the Trust. So being such a large trust with surely a lot of data, how has the Trust gone about reporting the data in order to understand their carbon footprint?
Like what I mentioned earlier, we have done a carbon footprinting exercise. So we know what carbon footprint is on each of the areas that we need to report on. So energy, gas, anesthetic gases, pharmaceuticals. So those kind of things we already know. So what we do then is we have what we call the sustainability initiatives tracker. So what it does is we have a list of the outcomes of it in terms of how much carbon it actually reduces and which scope it actually falls through. So if it, let's say if it's energy, so one of the initiatives that we put in, of course, is to buy 100% renewable energy. So as our source of energy, so that then carries a zero carbon footprints. So which means then that our energy carbon footprint, we can actually zero it out because it comes from renewables now, and it doesn't carry any carbon footprints. So that's how we actually report and account for our carbon footprint, and we do use the standard protocol, the GHG protocol.
What would you say has been the most challenging aspect of the reporting process?
It is actually when you come into scope 3 where the challenges are. So we did speak earlier about supply chain. At the moment, the reporting is actually based on the spend. So if you spend like £1, the current way of calculating it is you assign then a conversion factor to it, but it's based on spend rather than based on like energy. You base it in kilowatt hour what you use. So it's quite cut and dried. But this one is actually on spend. So it doesn't take into account what the embodied carbon of the product or the logistic carbon of the product. But I do understand that because at the moment, the market itself, the suppliers itself, are not, their accounting or reporting as well is not mature enough for them to actually provide us with the embodied carbon of their product or the logistic carbon of their product. So unless that side of thing is actually mature enough to give us that specific information, then our reporting in terms of the carbon of like the logistics or the supply chain will be always be just based on the pounds. And given that we actually have the issue, of course, of the price increases due to inflation, that carbon footprint is going to go up. It will go up and down depending on the market.
Does the trust report on things such as staff commuting or patient travel? Because I can imagine that can be quite difficult to keep track of. And I know some trusts use surveys. Has the trust found a way to kind of find that data easily?
Staff commuting is always been it's always been one of the difficult areas to look at. Staff commuting and also patient commuting. Unless you do a geographical plot of all of your where your staff are actually living, and then you then look at how they travel to the trust, then that's the only way you can create like some kind of a baseline on the carbon footprint on staff commuting. And that's the same way as well with patients. To actually create an accurate data, you'll have to do quite an extensive background work to get a proper accounting of that. Staff commuting and patient commuting is actually outside of GSG, but the NHS, as part of NHS Carbon Footprint Plus, is looking at it, because we do know that part of the carbon footprint, of course, is staff and patient commuting. But we are implementing initiatives to reduce that. So we're working with local transport companies like National Express to provide a discounted travel card to patients to encourage both patient and staff to choose sustainable mode of transport like buses, the train, cycling, walking. So we are implementing those. We have relative success on that one with our cycle to work scheme. We have over 400 staff signed into it, and of course we also have the discounted travel card available. And hopefully with the patient discounted travel card, we will then be able to have an impact on that one. And of course, the trust is implementing virtual clinics as well, which helps reduce miles, basically the carbon footprints of care miles that our patients incur. The other thing is, with the work we're having, let's say with the National Express, every patient that actually buys a ticket to commute to the trust, they will be able to give us a report calculating the carbon savings, so which would help then us account for that one.
Yeah, I mean, I think it's fantastic that the trust is actually putting these kinds of things in place. Like with the travel partnerships, it's kind of an incentive for patients and for staff to get involved and reduce their emissions. So that's always fantastic. So my last question, do you have any tips or tricks for other sustainability teams in healthcare regarding the reporting process?
I think it is about, for me, and based on our experience with trust, is that you need to look at what you have as a baseline in terms of your carbon footprints. So because without an idea of what your carbon footprint is, it's really difficult to target initiatives, because it's like basically shooting an arrow in the dark and hoping something gets hit by it. So by knowing what the carbon footprints, and then targeting initiatives to reduce those carbon footprints, and having a simple, not too complicated way of tracking that, then that's what makes the difference. So it's like what I said earlier, it's about looking at your carbon footprint. How can you address the each of the areas where your operation is actually carbon intensive, and having a simple way of tracking it. It doesn't have to be complicated, because the more you complicate it, the more that it becomes then a burden to those that needs to track it. So it's about small simple things that when you bring it together, actually it creates a bigger impact.
Yeah, I mean, I guess each trust must have their own way of reporting their data, and I think everyone's just figuring it out and trying to find the most effective way to get that info and data across. So that concludes our interview. Thank you so much, Janet, for giving us some insight into what Royal Wolverhampton Trusts are doing in order to reach their net zero goals. It's also been a really great opportunity to spread some awareness about the importance of sustainability, as well as the challenges that can arise from carbon reporting. Janet, I'd just like to offer you a few closing thoughts on sustainability in the healthcare sector, and just wrap up by saying, if you could ask people watching or listening to do one thing that could help, what would it be?
It would be actually, taking action as an individual, as a part of a team, and as an organization, because climate change is not something that will be out there and doesn't affect us. It is affecting us daily. And then if we don't take action, it's an issue that will haunt us in the next decades. So that's just my last words, is to encourage everyone to take action now, so that we can make a difference in the future.